Rheumatrex and Humira are two widely prescribed medications for the treatment of rheumatoid arthritis, RA. But when it comes to battling this chronic autoimmune disease, which one will come out on top? Many patients find themselves grappling with this very question. In this video, we'll delve into the differences between Rheumatrex and Humira, exploring their mechanisms of action, effectiveness, possible side effects, and overall patient experiences. Armed with this knowledge, you'll be better equipped to make an informed decision for your RA treatment journey. Rheumatrex, also known as methotrexate, is a disease-modifying antirheumatic drug, DMARD, that suppresses the immune system and reduces inflammation. It has been a go-to treatment for RA for many years. On the other hand, Humira belongs to a class of medications known as biologic DMARDs and works by targeting specific molecules involved in the inflammatory process. As we weigh the pros and cons of each medication, it's important to remember that every patient is different. What works for one individual may not work for another. Join us as we compare Rheumatrex and Humira head-to-head to see if we can determine a winner in the battle against rheumatoid arthritis. Understanding rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune disease that primarily affects the joints. It occurs when the immune system mistakenly attacks the body's own tissues, leading to inflammation and damage in the joints. This can result in pain, stiffness, swelling, and reduced mobility. While the exact cause of rheumatoid arthritis is still unknown, genetic and environmental factors are believed to play a role in its development. It is more common in women and usually begins between the ages of 30 and 50. How Rheumatrex works in treating rheumatoid arthritis. Rheumatrex, also known as methotrexate, is a disease-modifying antirheumatic drug, DMARD, that has been used for many years in the treatment of rheumatoid arthritis. It works by suppressing the immune system and reducing inflammation in the joints. Methotrexate is taken orally or administered through injections, and it interferes with the production of certain substances in the body that contribute to inflammation. By doing so, it helps to slow down the progression of joint damage and manage the symptoms of rheumatoid arthritis. Studies have shown that methotrexate can be effective in reducing pain, swelling, and stiffness in the joints. It is often prescribed as a first-line treatment for rheumatoid arthritis, either alone or in combination with other DMARDs. How Humira works in treating rheumatoid arthritis. Humira is a biologic DMARD that belongs to a class of medications known as tumor necrosis factor, TNF, inhibitors. It works by targeting a specific molecule called TNF-alpha, which is involved in the inflammatory process in rheumatoid arthritis. Unlike methotrexate, Humira is administered through subcutaneous injections and needs to be taken regularly. By binding to TNF-alpha, Humira helps to reduce the inflammation in the joints and alleviate the symptoms of rheumatoid arthritis. Humira has been shown to be effective in reducing pain, swelling, and joint damage in patients with rheumatoid arthritis. It is often prescribed for those who do not respond well to methotrexate alone or for those who require additional treatment to manage their symptoms. Efficacy and effectiveness comparison of Rheumatrex and Humira. When comparing the efficacy and effectiveness of Rheumatrex and Humira in the treatment of rheumatoid arthritis, it's important to consider various factors such as clinical trials, patient experiences, and individual response to the medications. Several clinical trials have been conducted to evaluate the efficacy of both Rheumatrex and Humira. These trials have shown that both medications can significantly reduce the signs and symptoms of rheumatoid arthritis, improve physical function, and slow down the progression of joint damage. In one study comparing the effectiveness of methotrexate and Humira, researchers found that both medications were similarly effective in achieving disease remission and improving quality of life for patients with rheumatoid arthritis. However, some studies have suggested that Humira may have a faster onset of action compared to methotrexate. It's worth noting that individual responses to medications can vary. Some patients may respond better to Rheumatrex, while others may find Humira more effective in managing their symptoms. It's important to work closely with your healthcare provider to find the medication that works best for you. Side effects and risks of Rheumatrex and Humira. Like any medication, Rheumatrex and Humira may cause side effects and carry certain risks. It's crucial to be aware of these potential adverse effects before starting treatment. Common side effects of Rheumatrex include nausea, vomiting, diarrhea, loss of appetite, and hair loss. In rare cases, it can cause more serious side effects such as liver damage, lung problems, and bone marrow suppression. Regular blood tests are often required to monitor the safety of this medication. On the other hand, Humira may cause injection site reactions, headache, rash, and upper respiratory infections. It can also increase the risk of serious infections, including tuberculosis and fungal infections. Regular monitoring for signs of infection is necessary while on Humira. Both medications have the potential to affect the immune system, which can increase the risk of certain conditions such as cancers and autoimmune diseases. It's important to discuss the potential risks and benefits of Rheumatrex and Humira with your healthcare provider. Factors to consider when choosing between Rheumatrex and Humira. When deciding between Rheumatrex and Humira for the treatment of rheumatoid arthritis, there are several factors to consider. Disease severity. The severity of your rheumatoid arthritis may influence the choice of medication. In more severe cases, Humira may be preferred as it is a biologic DMARD with the ability to target specific molecules involved in inflammation. Previous treatment response. If you have already tried methotrexate and did not achieve adequate symptom control, your healthcare provider may recommend Humira as an alternative or in combination with methotrexate. Lifestyle and preferences. Factors such as medication administration, oral versus injections, frequency of dosing, and potential side effects should be considered based on your lifestyle and personal preferences. Cost and insurance coverage. The cost of medications can vary significantly, and insurance coverage may also play a role in the decision-making process. It's important to discuss these factors with your healthcare provider and insurance provider. Ultimately, the choice between Rheumatrex and Humira should be made in collaboration with your healthcare provider, taking into account your individual needs and preferences. Patient experiences and testimonials. It can be helpful to hear from other patients who have first-hand experience with Rheumatrex and Humira in managing their rheumatoid arthritis. While individual experiences may vary, patient testimonials can provide insights into the effectiveness, side effects, and overall satisfaction with these medications. Many patients have reported significant improvement in their symptoms and quality of life with both Rheumatrex and Humira. Some have found that one medication works better for them than the other, while others have had success with a combination of both. It's important to keep in mind that everyone's experience with rheumatoid arthritis and its treatment is unique. What works for one person may not work for another. It's essential to have open and honest conversations with your healthcare provider about your goals, concerns, and expectations when considering Rheumatrex or Humira. Alternative treatments for rheumatoid arthritis. In addition to Rheumatrex and Humira, there are other treatment options available for rheumatoid arthritis. These include other DMARDs, such as sulfasalazine and leflunomide, as well as other biologic DMARDs like Enbrel and Remicade. Physical therapy, occupational therapy, and lifestyle modifications such as regular exercise and a healthy diet can also play a significant role in managing the symptoms of rheumatoid arthritis. It's important to discuss these alternative treatments with your healthcare provider to determine the best approach for your unique situation. Conclusion and final thoughts. In the battle against rheumatoid arthritis, both Rheumatrex and Humira have proven to be effective in reducing pain, inflammation, and joint damage. However, the choice between these medications should be based on individual factors such as disease severity, previous treatment response, lifestyle preferences, and cost. It's crucial to work closely with your healthcare provider to find the medication that works best for you. Regular monitoring and open communication are key to ensuring the safe and effective management of rheumatoid arthritis. Remember, rheumatoid arthritis is a chronic condition that requires long-term treatment and ongoing management. By staying informed, actively participating in your treatment decisions, and seeking support from healthcare professionals, you can take control of your rheumatoid arthritis and improve your quality of life.